Hello, everyone, and welcome back to Compassion in Action. I'm your host, Angela Weston, and today we have a very special guest who is going to help us break down one of the most fascinating yet often misunderstood systems in the human body, the endocannabinoid system.
Welcome to Compassion in Action, where advocacy meets real change, fighting for justice, equity, and healing, because every voice matters.
Joining us is Dr. Leah Johnson, a doctor of pharmacy who also holds a master's degree in medical cannabis science and therapeutics. With her background as a pharmacist and a specialized expert in medical cannabis, Dr. Johnson brings a rare blend of clinical knowledge, patient-centered care, and cutting-edge science to the conversation. She's compassionate about making complex medical topics approachable for everyday people. And today, she's here to help us demystify the endocannabinoid system, what it is, why it matters, and how we can all support it in our daily lives. So open up your mind and get ready to absorb some amazing information. Hi.
Hey, so excited to be here with you.
Thank you for joining us, Dr. Johnson. Welcome to Compassion in Action.
Thank you for having me.
Yeah. So did you want to tell everybody just a little bit about yourself? I know we just had a little intro for you, but is there anything special that you want to say about yourself today?
Sure. I'm happy to give a little bit of my background because a lot of people always think, well, what does she actually know and how is she considered an expert? So I actually started working in medical cannabis in 2020, in 2020. I began I did a couple certification courses just to get some general info, to get more info on how to utilize it as a medication. And then when I was working in long-term care facilities, which is also known as skilled nursing facilities or elderly homes, it's commonly known as, a lot of the patients were being put on a lot of antipsychotic medications to sedate them and have them calm. It's considered a chemical restraint, and the states are cracking down on that to make sure that this is not how we are, controlling the elderly population in these homes. So one thing we are supposed to do is remove antipsychotics. And I recommended, well, why not use Marinol, which is it's actually a synthetic, it looks similar. It looks pretty much has the same chemical structure as THC, but again, it's synthetically made in a lab. And what ended up happening is I was told that I was allowed to start working with hospice patients, because the providers figured, well, if they're already kind of set up that they're going to pass away anyway, it's not going to hurt to try it with them, sadly. But luckily, and I knew it wasn't going to hurt them. So luckily, actually, with 1 to 2 doses a day in a very low dose, Marinol's only 2.5 milligram capsules. Mm-hmm. And they were taking it at breakfast and dinner. And what we were finding is not only were they now not combative, their pain went down, their anxiety went down, they started to get hungry again, so they started eating more. And what they actually found is that when they were retested to see if they would still be a candidate for hospice, which means that they have about 6 months or less to live, a lot of people did what they call graduated off of hospice, meaning that their estimate was longer than 6 months. So that was fantastic. And so a lot of the patients I worked with actually graduated off of hospice just by adding Marinol for these patients that the doctor was convinced, they're terminal, they're going to die anyway, whatever. But a lot of these patients ended up not being terminal anymore and not being on hospice. Yes. So it was a great, and then I decided that at the end of 2020 to actually open my own practice, because I was a little frustrated having my hands tied about what I could and could not recommend to patients, knowing having my expertise, having my master's in medical cannabis science and therapeutics, along with my pharmacy doctorate, it's just got a little frustrating being told by these providers what I was and was not allowed to approve. So I did start working directly with patients at the end of 2020. And that's when I opened Alchemist Cannabis Consulting to work directly with patients throughout the country and overseas to help them initiate and to adjust their medical cannabis therapy, because many people are on cannabis therapy and actually are not taking it correctly. And if they adjust it, they actually find more benefit than what they were taking originally.
That's amazing. And so that kind of brings me to, when we're talking about cannabis and people not understanding, until I even started learning, I knew that cannabis worked, but we just didn't understand how it works with our bodies. So can you kind of help us demystify the endocannabinoid system, kind of tell us what it is and why is it important for our health?
Absolutely. And the endocannabinoid system is absolutely my favorite system, especially once practitioners and even patients really understand the system in the body, it starts making a lot more sense why it's effective. So just on a basic level, the endocannabinoid system is a system we've always had in our body. I believe all mammals have it. I believe in other non-mammals also do have the endocannabinoid system too. Not all, but some do. But all mammals do have it. What we find out is the endocannabinoid system is our signaling regulation system. And so what I mean by signaling is we have what's called neurotransmitters in our body. It's, to explain it better, it's pretty much a neurotransmitter is just somebody yelling something. So for example, if you're in pain, it's because you have a neurotransmitter going, I'm in pain, I'm in pain, I'm in pain. And lots of neurotransmitters are going around screaming, I'm in pain, sitting on receptors to say, I'm in pain. So that's how it works. So what is supposed to happen naturally in our bodies is when we have this excitatory neurotransmitter to say, do something, and it is being over provided. What's supposed to happen is that our endocannabinoid system on the postsynaptic neuron, so this is on our neurons in our body, we have presynaptic and postsynaptic. Post just means after, pre means before. So what happens is that all of a sudden these screaming neurotransmitters, again, they're not actually screaming, but for this screaming neurotransmitter sending screaming messages to you. And what happens is they go to from your presynaptic neuron to your postsynaptic neuron, sit on the receptors to express these urgent messages. Then what happens is your endocannabinoid system releases anandamide. Anandamide is actually our natural version of THC that our body has always naturally made. And this is what other species naturally makes in our system. Again, anandamide, it's called, ananda is the root word for bliss from Sanskrit, meaning bliss. And the anandamide, what it does is it actually gets released from the postsynaptic receptor when it gets all these messages, especially too many. It goes to the presynaptic receptor, the one that's sending these messages, saying, whoa, we got you. We got your signals. You don't need to keep yelling at us. We got you. And so that's very lowbrow version, not very lowbrow, but very low level version of how it works. But that's how it technically works. So what happens is you're getting too many messages. It releases the anandamide. The anandamide goes back and says, please stop releasing messages. We're all set. We know what's going on. And then by having those receptors decrease and no more messages or minimal messages being sent to the postsynaptic receptor, it decreases that excitatory response, the pain, the anxiety, the seizures, and so on, excuse me, and so on and so forth. So what happens when you get older, or depending on how your endocannabinoid system is at birth, for example, patients with autism spectrum disorder at different levels are actually found to either have minimal anandamide or no anandamide when they're born. So they don't have the natural anandamide to do these negative feedback saying, we're good, stop doing that. They don't have these. So that's what makes some of their, especially and that's why a lot of children with seizures, we're seeing the same thing. They're not making this anandamide, or at least not enough to stop these excitatory responses. So what happens is, as you get older, or like I said, if you're born without it, as you get older, though, your endocannabinoid system, along with every system in your body, starts breaking down, as most people that are over the age of 35 have seen. And so everything starts breaking down. And so what we need is, I always like to compare it to insulin. So if your body's not making insulin, or not making enough of the right insulin, you have to supplement your body with insulin to replenish what is missing. It's exactly the same thing with the endocannabinoid system. If you're not making enough anandamide or 2-AG, which is our body's similar version to CBD, what ends up happening is we take the we intake the medical cannabis, and the THC will work very similarly to how the anandamide works. And it will also get released and also go back and say, we have enough messages. Please stop sending us messages. We know that there's a problem. We're in the middle of fixing it. So it's kind of like, I always like to say that the endocannabinoid system is kind of like that traffic guard in the middle of the road. That's like, okay, come on, send in signals. Oh, wait, no, stop, don't send in signals. And again, if you don't have if the traffic guard is, not paying attention, you're going to have a lot of mess and accidents and issues. So that's why we need our endocannabinoid system. And sadly, it's one of the most overlooked systems when it comes to medical, medical education. There's a lot of education on every other system in our body, but for some reason, the endocannabinoid system, even though it's a natural system in our body, has often been overlooked. And just now, drug companies are starting to try to find medications that will work on the endocannabinoid system. But again, I mean, the system has been known about and has been around for, over, almost like, I think at least 50 years. And at this point, we still do not have, medication for this specific system. So it's something that's being worked on, but that's where, like I said, the medical cannabis products come in to replenish what's missing.
And I think that's why the natural plan is so important. And so with that, coming to talking about that in the endocannabinoid system. So we talked about anandamide, we talked about 2-AG, and that's the natural endocannabinoids, the cannabinoids that we actually make. So let's talk about the two that we do not make, that comes from the plant. And if I'm not mistaken, they're called phytocannabinoids, right?
Yep. Phyto meaning plant, endo meaning internal. Yep.
Right. So with that, when we make our own, how does THC and CBD interact in the body, in just like the 2-AG and anandamide do?
So what we find is THC is more similar to anandamide than we found CBD being to 2-AG. The biggest difference between CBD and 2-AG is that 2-AG still binds to the actual endocannabinoid receptors, where CBD, for the most part, actually doesn't bind to the actual cannabinoid receptors in our body. You need a lot, like a very high level of CBD to do that, and it really does not like to go onto that receptor. Where CBD actually works mostly is, they call it, the fancy schmancy term is an allosteric modulator. All that means is it works as a buddy on other receptors throughout the body, instead of working directly on the endocannabinoid receptor. So for example, your cells have all these receptors on them. You've got this cell and you've got this message that's, sits on the cell, but it's working, it's working pretty good. And then you have CBD that comes and sits on a side receptor of this, my thumb's the cell. This is the receptor that the original neurotransmitter attached to make sure that we're getting pain relief. But then here it sits over here and says, I'm going to make you work better. So that CBD very often will work on other receptors on a side part of the cell, on a side receptor, and will help make the reaction function better. It doesn't cause it, but it assists. It's kind of like your helper. CBD is kind of like your helper cannabinoid. It helps other cells and other receptors do what they're supposed to do properly. But THC, on the other hand, is they call it a partial agonist. Again, fancy term. All that means is it partially will attach to the receptor of the endocannabinoid system. It does attach to the CB1 and CB2, but CB1 is mostly, there's only CB1 and CB2 receptors, which is cannabinoid 1 and cannabinoid 2. The cannabinoid 1 is mostly in the brain and in the CNS. The central nervous system. And then then the CB2 receptors are more on the periphery, like your lymphatic system and your cells and everything. So the biggest thing is that it does work on both, but again, the CBD doesn't actually bind to the receptors the way that THC does. And the other thing is to know is the reason why we don't realize we even have an anandamide in our body that works is because it gets broken down very quickly. It gets produced very quickly. It has its action very quickly, and it gets broken down very quickly. So it doesn't keep working. So you can't feel it. It only gets produced when your body needs it. However, THC is a little different. It likes to hang around. It likes to be buddies. It doesn't like to go anywhere. So it doesn't fully bind, but it is much more strongly bound. So what that means is that it's not going to do its action pop off like the anandamide does. It's going to stay a little longer, which then at times can cause those potential side effects of the cannabis, such as sleepiness or dizziness, because again, it's more than it's not dropping off or getting broken down as fast as our system would normally do it.
Okay. Yeah, that's amazing. It's amazing that we have such a system in our body that a lot of us did not know about. Like I said, I didn't know about it until I actually went to school. And in fact, Leah and I, just like we talked about Dr. Cody on our last show, we all graduated from the same program. So I learned a lot in that program as well. And just learning about the endocannabinoid system and what it did just was really amazing to me, just to find out, just like I said, cannabis works, but how did it work? And what did we have in our body? And why did it stay in our body for such a long period of time? So understanding about the CB1 and CB2 receptors. But I like the way that you broke that down. I will say that because oftentimes we don't, when we're talking from a medical standpoint, for patients, we need to have things in layman's terms. So I really appreciate how you broke that down and made it so easy for a patient to be able to understand that. Because when you were talking about that, I kind of visualized a guy standing there with a little orange vest on.
Yeah, and that's kind of how I try to explain it to my patients who have autistic children that I'm working with, is it's like, imagine a traffic guard just crosses his arms and doesn't, or his or her arms and just doesn't do anything. You're going to have crashes. You're going to have people beeping. You're going to have accidents. It's just going to be chaos. And that's literally what's happening in the brains of these poor children with epilepsy. It's just everything is firing, and it needs to have the traffic guard back saying, you go here. Nope. You wait. Nope. We had enough of you. Hold on 1 second. And so on and so forth. And what you find is once the signals are set properly and responded to properly, it just calms the entire system. And that's why it works. A lot of people say to me, well, I don't get it. Like, why would cannabis work for sleep, but also work for pain, but also work for seizures? It makes no sense. It would work for multiple things. And my answer to them is, it's where it works that makes the difference. We're not curing the symptom. Well, not curing. We're not trying to fix the symptom. We're fixing the underlying problem, which is more important, in my opinion, than the symptom. Because if you fix the underlying problem, then you don't have the symptom. So, and that's what happens. So, when you get those, those neurotransmitters, constantly firing, saying pain, 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 the cannabis says, shh, We know. And it's seizure, 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 seizure. Shh. And it's, oh, like I'm just wide awake and wide awake and wide awake and wide awake. Shh. And that's kind of what the cannabis does in the brain is, I don't want to say it quiets it, but it decreases those signals so that those signals aren't telling you something. It's not telling you you're in pain anymore. It's not telling you you're having, you know, you're convulsing. It's not telling you that you're wide awake. It's reducing those signals so you can actually function properly.
That's wonderful. And that's what I think we should always take a look at is what's the root cause of everything. And so having a plant that actually will go and work on the root cause to ease your pain, to ease your insomnia and your anxiety, all of those. So that it's such an amazing plant. And there's so many more cannabinoids out there, everybody, than just THC and CBD. I know those are the most popular ones, but there are others that are there. So definitely take a look into those as well. And I know at some point we'll start talking about other cannabinoids as well in some later episodes. But kind of wanted to move on just a little bit because I know we're talking about some of the we're talking about the anxiety and so forth, and that falls into the mental health realm. So how can cannabinoids be thoughtfully integrated into a mental health for support plan, especially for depression, anxiety, and insomnia?
So for the biggest thing I always say is it's very important to work with a cannabis professional that is also some sort of clinical professional, such as any sort of practitioner. So somebody who knows the human body, who works with patients, as well as somebody who is an expert on the endocannabinoid system. The reason I say that is because the way the medication works is you need to know based on the ailment and based on past history with cannabis or other meds or current meds the patient's on. You need to really do a full comprehensive review to really see what's going on before you make that decision. So some people find, so the biggest one I would say, like, let's start with insomnia. That's just the most common one we see, especially for elderly. So, with that type of thing, such as insomnia, you want to make sure that to see what they can tolerate, because some people can actually take CBD and sleep very well on it. Oddly enough, the research is kind of 50-50 on like how effective it truthfully is. But on an anecdotal level, a lot of patients I've worked with do great on high doses of CBD with very minimal THC for sleep. Others, even a little bit of CBD has them just partying, not partying, but like wide awake. I personally will say that if I use a high dose of CBD, it actually acts as a stimulant to me and not a relaxant. And so that's why you really need to work with somebody specific, because you need somebody that can analyze your full comprehensive presentation, and then from there really make a decision what might actually be the best option for you. Because if you just put everybody on, let's just put everybody on high CBD, low THC, you might do that with somebody with insomnia, and then not only are they going to have trouble sleeping, they're just going to be up all night. So that's why it's so important to work with somebody who knows the ins and outs. The other thing as well is when it comes to anxiety, they've also, it's important to also know that very low levels of THC actually are very effective for anxiety. But as you increase that dose, it can actually cause anxiety. And so what we find is that a lot of times for anxiety, the higher CBD with the lower THC is actually helpful. But some people, but again, the dose of the CBD and THC really depends on the patient, because I have some patients on, I think, they're on probably about 10 milligrams of CBD and 0.5 THC. And again, these are very little ones, all the way up to these patients who are on, 100 milligrams of CBD and 100 milligrams of THC based off of what they need for their endocannabinoid system. And especially, tolerance also plays into it as well. If somebody's been on cannabis for a long time versus a cannabis naive, meaning cannabis they've never used it, it can make a big difference on dosing. So I always recommend speak with a professional. Depression is a hit or miss type of ailment, because depression is a little tough because based on just, I mean, not that it doesn't work. I personally have a patient right now. He only finds benefit with flower, which means inhalable, and he will use inhalable about once an hour, a small puff once an hour, and it actually keeps his anger and depression at bay. But other people couldn't function on that. So it really depends on the patient. Some people do a little better with THC for depression. Some people, the CBD might help. Some people, the CBD doesn't help. So it really depends on the patient. And that's why, again, I always recommend working with somebody because they can help you kind of navigate your endocannabinoid dysfunction to figure out what's the best type of cannabinoids, what's the best dosage, and what's the best other components such as terpenes, polyphenols that should be in a product to help maintain the patient health.
Yeah. And so for me, just thinking about that is why I strongly suggest that we always continue to have some sort of a medical program for patients, because we definitely need to have that relationship with the provider for just like any other medication that you have, where you're tracking. They give you a medication, you start off with one dosage and you realize, okay, that's too much or not enough or what have you. But it takes that level of education or a level of care, I want to say, for you to be able to know that, and just doing that on your own and not having a way to be able to track that and have someone to talk to you about that. I think we're doing ourselves a disservice by not having that. And that's why I think where the harm comes from patients, and when this plant should be a harm reducer.
Absolutely.
I think that, yeah. So definitely having that patient doctor relationship so that they can better understand and know what's going on with their body as they're using it. So definitely I do agree with you with that.
Yeah, the biggest thing I have is it's not usually the first dose that, people just start on whatever. The real question is, once I do a dose and get this response, what do I do next to fix that? And that's really where the practitioner comes in and says, because and the problem is that a lot of people will go to dispensaries assuming that dispensaries have medical advice. The majority of dispensaries, depending on the state, of course, but I know I'm from California, and the state of California, it is not obligated that a healthcare professional of any type is at a dispensary. So they only have bud tenders, and bud tenders can be either very knowledgeable or not knowledgeable at all. But at the end of the day, it's actually illegal for anybody that is not a practitioner to provide medical education to patients. So technically, the dispensaries are not even allowed to really provide proper info. And this is where patients really struggle, because, all they can do is say, well, I have insomnia, what do I do? And then the bud tender really by law can really only say, this is what a lot of people have been taking. This is what people take. But then again, very often they're recommending a 5 milligram gummy, a 10 milligram gummy. I never recommend gummies for medical, because most of them are isolates, and isolates are not really are not as effective as whole plant medications. The other issue also is that often 5 milligrams even is way too high for a lot of these patients. Some of these patients need to start off like even less than 1 gram, which is almost impossible half the time to get from these gummies, especially if they're 10 milligram, you're going to cut it into 10 little pieces equally. It's not the easiest thing to do. And then most people will just tell the patients, oh yeah, just take one. And, if you don't feel it, you can take another. But they don't explain the duration of how long to wait. They don't explain anything. And then a lot of the patients that I have worked with, what ends up happening is they come to me saying, well, I'm coming to you, but I'm very hesitant. I went to a dispensary for my insomnia. I took a gummy. I always ask how many milligrams. It's usually either 5 or 10. And then they said, and then like after a half hour, I didn't feel anything. So I took another one. And I'm like, and this is such a common thing that cannabis practitioners hear about all the time is starting dose is too high, and B, redosing is too soon. So, I mean, that is one big thing, is you really need to know your formulations. Like, you need to know that for a gummy or anything that's like a capsule, it's going to take up to between an hour to even 2 hours if you have a very slow metabolism to work. So you really shouldn't redose for at least an hour, if not 2 hours. And also the starting dose should be a lot lower. And then you've got beverages, like the company Can is one of them. But there's many different beverages depending on the state. Those actually will kick in a little faster, between about like a half hour to an hour. So those are a little bit better for if you want sooner effect. And then lastly, and then the tinctures kind of fall in between those. Some of the oil ones are usually closer to the length of time as the gummies and the capsules, where the alcohol tinctures or water soluble tinctures are closer to the 15 to 30 minutes. And then inhalation is the only thing that's direct effect. So a lot of people really are very anti-inhalation. However, what they actually find out is inhalation is a very necessary dosage form, and it's specifically for breakthrough. So if you think about it, especially cancer patients are the best people as an example. If you have cancer and you're on chemo and you are gonna I am going to throw up right now. Like, there is no stop. It is not going to be in a couple. It's going to be this very second. That little, that 3-second inhale on a vape pen, or a very, very small inhale of flower, that can stop that nausea and vomiting feeling in its tracks almost instantly. If they're using obviously the correct type of vape pen and the correct type of flower. And so the same thing happens with pain. If you have taken your cannabis pain medication and halfway through until your next dose, you have a severe pain, you need something to work right now. So again, inhalation at a very low dose and used properly is actually quite effective for breakthrough pain, and also for insomnia. In the middle of the night, you wake up and you need to go back to sleep, a tiny little puff or a tiny little vape pen puff, you go right back to sleep. So that's why I know that a lot of states, especially legislators who don't really understand medical cannabis, don't understand, and they automatically associate inhalation with recreational use.
Yes.
What they don't realize is that different dosage forms are for different levels of medication. The shortest acting, which is inhalation, is for immediate symptom relief, and the longer acting is for preventative. So they really need to have both if you're a patient, and be allowed to have both to make sure that they're getting their ailment fully covered. And so it's a very big misconception that that inhalation is only recreational, because it's absolutely not. And there are so many cancer patients I've worked with that, that are so grateful for the small vape pen, the small little dose, because they can just bring it with them, take a tiny little puff, get rid of that nausea and vomiting feeling, and then go back to feeling normal again. And, what a wonderful thing instead of vomiting all the time, and a lot of those meds they give you, sometimes they work, sometimes they don't work for the anti-nausea and vomiting. So to have something that works almost instantly for that feeling, it's really important to have a short acting, fast acting recovery symptom method.
Yeah, I'm glad you mentioned that. And we were talking about the states. Our state, Georgia, is one of those. We definitely tried to get inhalation, and it didn't go anywhere. And it's because of that lack of understanding. So I wish we had you here as an expert witness in committee to talk to them about that. Because it is so needed, and they're missing out because they really don't understand it. That stigma is very strong. And yes, they do, compare that to recreational, but not understanding that it is truly medicinal and truly needed. So maybe we can show them some videos of you talking about that.
My favorite quote from my toxicology professor in pharmacy school is, the dose makes the poison. You can overdose on water if you drink too much of it. There's actually, there's cases of students in college hazing each other with water and dying from drinking too much water. Like, obviously, a lot in a very small period of time. But it's the
Mm-hmm.
same thing with cannabis. At the end of the day, the dose makes the effect. If you take too much, yes, you will have an issue. And the biggest thing people don't realize is, for the most part, the euphoria or the high is actually a side effect. You're not
Mm-hmm.
supposed to be getting high from it. You're not supposed to get euphoria from it at the medical level. You're supposed to just
Mm-hmm.
have your symptoms resolved. And if the dose is slightly too high, it could be causing these extra effects. So you'd want to bring down the dose a little bit. So I guess the biggest problem is when most people inhale, again, and this is where a educated professional comes in, they don't know how to take a small amount. They don't know how to do a small dose inhaled. And that's really where the training comes in, to educate how to do a small dose for breakthrough symptomatic therapy.
Mm-hmm. I agree with that, because really, when you think about that, we get the vapes and so forth. There isn't any training on how to do that. So when you take that first one, you just kind of sucked it in, and all of a sudden you go to coughing and so forth, but no one ever taught you about how to. So that I really, I like you saying that, because that's something that truly is needed as well, is that education and knowing how to do that. And so that's where that medical professional does come in, to be able to give you that education and help you in that area. So I totally oh wow, this is amazing. It really is. But just when we're talking about the dosing and the timing of everything, and so with which cannabinoids do you think that show so much more promise when it comes down to mental health naturally?
So it all depends, truthfully. It really depends on the endocannabinoid function of different patients. And the only reason I say that is because I've had patients with anxiety on actually very high doses of THC, and it was actually surprised they weren't getting the paranoia and the higher doses of what they needed to help them. And other patients if they had, almost like an insignificant amount of THC, was almost too much for them. So it
Mhm.
makes it difficult for mental health really to kind of pinpoint cannabinoids. I will say that it really depends on, it's kind of like saying, well, we don't know how much insulin or which specific type of insulin to use in the body until we know where the, is it the long acting insulin that's missing, is it the before meals that we're missing. And it's the same
Mhm.
thing with cannabis. It's when is the timing of the ailment, when is the how often does it happen, what is the breakthrough, what is the current symptoms. So it really just depends. The one thing I can say though is that people that are utilizing CBD, often
Mhm.
I've had to switch them, not often, but every once in a while I've had to switch them to CBG. That's
Mhm.
cannabigerol.
Girl.
It's
Mhm.
and for those who don't know, CBG, the way the plant works is the plant only makes cannabinoid acids. So meaning THC or CBD, you just put a tiny little itty bitty A at the end of that
Yeah.
those letters, and that's actually what
Mhm.
the plant makes. And then when you heat up the plant, that's when the A falls away and you have the regular cannabinoid that you're used to. So
Mhm.
CBG is actually the primary cannabinoid that from CBGA you get THCA and CBDA, which turn into CBD and THC once you heat them. So
Mhm.
what we find is that because CBD binds, as I mentioned before, to like kind of, it likes to be everybody's buddy, as my friend Cody Peterson likes to say, they're very promiscuous. He loves saying that CBD is very promiscuous. So it's true. CBD likes to bind everywhere. It's like, I'm going to bind here, I'm going to bind there. So sometimes it can sometimes like not cause the effect you're looking for and cause a
Mhm.
stimulation in an area that you're not looking for. And if that's found, we often will move people to CBG instead of CBD, because the
Mhm.
CBG has similar properties to CBD, but we find that it binds better to the receptor, and it does not cause all those allosteric, all those side, helping to the other
Mhm.
receptors like CBD does. So that's one thing we
Mhm.
fix a lot. Is CBG is definitely is definitely one that is we've been talking a lot about and is very effective, because like I said, especially for insomnia, even sometimes THC is too strong and CBD is too energetic. or energy inducing for some people. And so the CBG will prevent that energy inducing of the CBD, but not be as sedative as the THC. So what we find is that CBG is a great alternative to CBD if the patient can't tolerate CBD. And a lot more companies are making CBG products now. We also find that the difference between like a broad spectrum and a full spectrum product, because some people for mental health disorders, they can't handle a full spectrum product. I had one patient for anxiety, and she could not even handle like even 0.05 milligrams of THC, which is almost pretty much nothing. She couldn't even handle that. She could feel it. And so for her, we had to provide what was called a broad spectrum, which is all the cannabinoids in the full spectrum, all the polyphenols, all the terpenoids, but removing the THC after the product is extracted. And then that way, for those people who really can't tolerate the THC for their mental health ailments, they at least have an option to not have that THC, which could be sedating. So it's hard for mental health for specific cannabinoids, just because the cannabinoids are different for different patients. And some patients can do great on CBD. Some people need CBG, and some people can do great on THC, and some people need to have a broad spectrum without the THC. So it really depends on the patient. And also terpenes are also quite effective. And what they've showed is the same. I mean, there are studies that show one terpene or one cannabinoid over another for different ailments, but at the end of the day, they all seem to work synergistically together, and what they call the entourage effect, to help support each other, to help and benefit, which is why the full spectrum products, the whole plant full spectrum, I specify whole plant because now it's become a marketing thing that people use isolates and they're calling it full spectrum, which is not a full spectrum. So for those of you looking for good products, you're looking for a whole plant full spectrum product, not just full spectrum, or whole plant broad spectrum, not just broad spectrum, because otherwise it becomes made with isolates instead of a full extraction.
Okay. Wow. So I kind of want to go back a little bit. I know we talked about autism, and just kind of want to step back a little bit with that. And have you seen certain formulations that deliver methods that work better for neurodiverse individuals?
It also, again, that's the problem with cannabis, and that's why I always recommend it. It really is patient specific. So I've worked with many patients with autism. I have had patients who do very well. So there's 3 levels of autism. There's level 1, which is usually what we used to call low functioning autistic, and then there's level 3. Let me just make sure I got this right, because I was getting this all. I don't want to get this all backwards. ASD levels. Yes, I want to make sure that I'm not putting it backwards. Yes, so I was correct. Yes. So level 1 is the lowest form, the lowest severity. And again, I just want to make sure I'm not providing incorrect info. And so it is the lowest severity. I used to use lowest functional, and highest functional originally. So highest functional level would be a level 1, and lowest functional would be a level 3. And what I found is that with the higher functional, the level 1 autistic patients, they usually, it's funny, I kind of associate them similarly to like a type 2 diabetic, meaning they are making something, but they're not making everything they need. So what we find is that CBD dominant is quite often effective. I mean, often for any of these ailments, CBD dominant is effective unless they can't tolerate the CBD. And full spectrum is effective unless they can't tolerate the THC. But what we find is that for the level 1 autistic patients, the higher functioning, they do much better on the CBD because it helps regulate the anandamide that their body is making, the little bit it's making. And it also usually it's a full spectrum, so there's still usually a little bit of THC that gets added in. What I find for the level 3 patients, the lower functional patients, what we find is they actually do better on a little bit more THC, because the THC doesn't end up causing a sleepiness or dizziness. It causes the feedback loop in the neurons to work better, as I was mentioning before, that messaging signal, because that's what anandamide does, is it says, stop sending signals. And that's, again, what's going to happen in the lower functioning at type 3. But a type 3 ASD patient, or patient with ASD, is very similar to like what I associate it with a type 1 diabetic. They're not really making any, or if they're making, it's extremely minimal. So you really need to fully replenish it versus just giving kind of like assistance, for lack of better terms. So it really depends on the patient. The interesting thing about autism is the cannabinoids that are used are not age associated, which I found. So I actually have had patients that are that have autistic spectrum disorder, that are in their, that are like 18 and 20, that are using a much lower dose than I have patients who are 5 years old or 9 years old using. And it just happens to be with what their endocannabinoid deficiency is and what they can tolerate. Oddly enough, the 9-year-olds can tolerate THC without a problem, even at a 0.5 milligram, yet the 20-year-olds can't tolerate THC at all and has to be on a broad spectrum. So it's just very interesting, because again, you cannot make an assumption that, every age you have to focus on it. You really have to, at the end of the day, focus on the endocannabinoid tone in the and each individual patient's endocannabinoid system. And that's why it's very hard, because people, obviously, in the medical practice, you just want a dose. Give me an ailment, give me a dose. Give me an ailment, give me an age, give me a dose. Okay, so you've got this ailment for this female, male, this age, this person, this age. What do we do? And that works great in medicine. And actually, truthfully, it doesn't work great in medicine. Hence why so many people have so many side effects.
I was about to say that that doesn't really work a lot of times with medicines either, when you go by age and so forth, because it just depends upon what your body can tolerate.
Exactly. And when it comes down to it, the doctor goes, guidelines say blank. Let me throw that at you. Guidelines say this here. Guidelines say this here. Cannabis, there is no guidelines. You follow the patient. And that's why, like I always say, people are like, just tell me what the dose is. Just tell me what the cannabinoids are. Just tell me. It's hard, because every single patient, and the best example I can have is twin siblings, identical twin siblings. They can both start cannabis therapy. One can do great. One can do horrible. I actually had there was actually patients that were two identical siblings using cannabis, both for anxiety. One triggered her to having paranoia effects. The other one did phenomenal on it. And the one that triggered the paranoia, she actually got off the THC, went to a broad spectrum. It still was, and it was still, and like she was okay on the CBD, but it wasn't really super effective for her. But it wasn't causing the psychosis not causing the psychosis, but it wasn't causing those side effects that her sister was having. So her sister, again, identical twins, sister's doing great, other sister not so great on cannabis. And that's why I always say you have to monitor the patient. That's why when you work with a cannabis professional, everybody works a little differently. The way I work is that once the patient has the general product that we've decided should work the best for them to start off with, we check in with each other actually after every dose. So I usually have them start at night, depending on their ailment, but especially insomnia or something that needs to be taken around the clock for like seizures and stuff. We'll start at nighttime and check in the next morning. If the next morning I'll say, hey, how are they doing? If the answer is, oh, they're doing fantastic, they're doing so much better, great, then we know that's a good dose, we'll keep on it. If they say, oh, it seems to be effective, but they were very sleepy this morning, like I couldn't even wake them up, or I could barely wake up myself. Okay, well, then we know that the dose is potentially too high, or at least the dose of the THC might be too high. And then, if they say, oh, I don't really feel any different, well, then we know that the dose is way too low, and we don't know if we don't know if it works in general, and we don't know if maybe it just needs to be increased. So that's when you go back and forth and you play with the dose. You don't want to play too often. So once the patient kind of gets, after the first couple days, once the patient kind of figures out about how often or about how long the cannabis seems to be lasting for them and about what dose seems to be effective, you usually give them a good 3 days. Even if it's not fully effective, you give them about 3 days on that dose, taking it regularly, and then check back in after 3 days as long as there's no issues. And, by then we should say, do we need to increase the dose? Is the dose okay? Is the dose too strong? I mean, obviously, usually if the dose is too strong, the patient usually contacts us earlier to say it needs to go down. But all in all, this is what makes cannabis therapy so difficult and why most providers don't even want to learn about it, because it's too complicated. Because at the end of the day, the providers want, well, what's the name of the pill? How many tablets do I give? How many milligrams do I give? It's like, I wish I could tell you with cannabis. I wish it was that easy, but truthfully, like you said, and I said, medicine isn't that easy. And honestly, like if everybody were to use more of a liquid version rather than pill versions of pharmaceuticals, they would probably be able to titrate their dose to the actual dose they need, as opposed to being on a dose that's slightly too low for them or slightly too high because the pills are regimented and it's either this pill or this pill or this pill. It's like, well, what if my dose is in between the two and I can't cut the pill? Well, what do I do?
Pill.
And you just go with the lower dose. You go with the side effect of the higher dose. And it's like, this is why the method that we use for cannabis is actually the method that should be used for all pharmaceuticals. But obviously, once pills come, they don't do that anymore. And they kind of hope for the best. But with cannabis, we don't play that game. With cannabis, we're very specific on making sure we see, okay, so we give you a dose, see how it affects you. And then based on it, how it affected you, did it give you too much energy? Did it give you too much sedation? Did it have an effect? Did it have no effect? All this will all be added in together to figure out what the next dosing should be for the patient to be adjusted to.
Yeah, I was just thinking about the patient that you were talking about, the one, couldn't wake them up the next morning after that first dose. I was just thinking, I'm like, maybe they were just so darn tired. Maybe it was the right dose, but they hadn't slept in so long.
So that's exactly what we ask the patient, because at the end of the day, it's the patient needs to be comfortable with the dose. So if the patient says to me, oh my God, I could barely wake up, I'd say, oh my God, that dose might be too strong for you. But if they say to me, I actually feel great though. I mean, I'm sleepy, but like I feel refreshed. Let's try one more night on that. And I'll say, sure, let's do it one more night. And if you still feel sleepy the next day after getting a full sleep this past night, that might mean the dose is still a little too high. So we should go down a little bit. But if they if they take the same dose that night, the next morning, they're like, I feel wide awake. I feel great. And if they feel a little sleepy, then we'll reduce either the entire dose or just the dose of one of the cannabinoids, a little depending on how their response was.
That's interesting. And so with that, I know it's based on a specific patient. So when you're working with those patients, and how did you get to a point where you fully understood, or maybe not even fully understood, but get to a point where you kind of understood which ones you need to remove, which ones you needed to add more of? How did you get to that point?
It really comes down to people laugh when I say this, but they call it a medical practice for a reason. The more that you have, the more patients you have, and the more patients you work with, the more that you see how patients respond. You see, what has helped one patient. You'll say, oh, well, when this happened to my last patient, I did this and it helped them. So let's try that again. And sometimes it's going to work great. And sometimes it's not going to work. But truthfully, in any medical practice, it's the same thing. They're going to, the provider is going to start with what they have done in the past with people with the exact same presentation. And then if it doesn't work, then they start, making adjustments. Okay, in the past, when this hasn't worked, what have I gone to? What has worked? And so on and so forth. So it's the same with cannabis, where just honestly, the more I work with patients, the more that I'm able to really see the ins and outs of what's affecting, what's not affecting. A lot of times, like, for example, for pain, for example, if you see for pain and insomnia, let's say that the patient slept really well, but they still had a lot of pain in the morning and they kind of like, they slept throughout the night, but they still kind of maybe woke up once in pain. Well, that to me would tell me that maybe the formulation they're using is effective for their sleep, but it's not effective for their pain. So then we'd have to adjust the, figure out which cannabinoids are being, so we would first, alter one of the cannabinoids and see what it, did increasing THC or did increasing CBD make this patient better, or did it make it worse and make no difference? So if like we increase the CBD and it made no difference to the patient, then we know that it's that we go back down to the CBD that it was, and then increase the THC because increasing the CBD didn't hit where we needed to. So so we increase this. Okay, so now that's helping your pain. Great. So then we know that cannabinoid is where to stick. So I mean, it's also knowing the different cannabinoids, knowing their general side effects, such as, THC at a high level can cause anxiety. THC at a high level can cause, can cause a lot of sedation or the euphoria. So if, like, for example, if people are saying they're feeling pain and they wake up in the morning and they feel very sedated, but they have no pain, well, then we probably want to reduce this THC because it's probably too strong. The THC might be a little too strong for them. But again, it's every patient. And just because I think it's this cannabinoid causing the problem and I adjust it, it doesn't mean it's going to be that cannabinoid. All you can do is use your past experience with other patients to, utilize it. I mean, that's kind of how all practitioners work is, you take your education and your, experience. And that's why when people are trained in cannabis therapy and the idea of straight education, but they don't actually work with patients, I always say, make sure you're working with somebody who works with patients, because you can learn, because there's a lot of things that are anecdotal still versus what studies are showing. And I'm not saying that the anecdotal is wrong, and I'm not saying the studies are wrong. I'm just saying that right now we don't have a clear-cut view. And because we don't have a clear-cut view, it's very important to work with somebody who's worked with many other patients so that they have the experience of what to start with and then what to alter to when whatever they're suggesting isn't working.
That's good. So, and get segueing into this, when you're talking about patients and the relationship with their providers, how would you empower, or what would you say to a patient when they want to have this conversation with their providers, especially those providers that are not pro cannabis?
Yeah, so it's quite hard. It's funny. Some practitioners know nothing about it and are very against it. Some practitioners, which is funny to be very against something that you know nothing about. Some practitioners are very against it and know a little. Some practitioners are completely for it but know nothing about it, and a very small amount of people are both educated in it and support it, which is, again, it's really the lack of education really in the medical fields is the problem. So there's two things. I always make sure that I'm working with a patient who has a primary care physician or neurologist, if it's seizures, depending on obviously what GI doc, if it's stomach issues, that their doctor, one of their doctors on their medical team, knows that they will be starting cannabis therapy with me. When I write up their consultation, I write it up as if I'm writing a normal consultation for that would be read by another provider. So if the patient decides to bring it to their provider, they will have the medical write-up as well. The biggest thing I always say is the number one thing: do not hide that you use, and say medical cannabis. Don't say marijuana. Don't say pot. If they say, do you use any illicit drugs? No, you use medical cannabis. And this is the biggest thing. I'm a huge proponent for this. When it lists your medications, medical cannabis is your medication. Do you use illicit drugs? No, because you're using medical cannabis. You're not using an illicit drug. You're using medical cannabis. That is one of your medications. So that's one huge thing. And to make sure to always use the proper term, medical cannabis, because it takes the stigma away. That's the first thing. Also, by calling it medical cannabis and calling it a medication, it takes the stigma away from the provider as well, from seeing it as a drug. And then if you do have a provider and they are very apprehensive. They try to convince you not to use medical cannabis, and they're just very pushy about not doing it. I hate to say it, but find a new provider. And that's what I've recommended all the time, because it is worse to lie to your provider than it is to have a provider that knows what you're on. Because, for example, and I've seen this happen a lot. This didn't happen to one of my patients. This happened to the wife of a colleague of mine. If she was one of my patients, I would have told her she had to tell her doctor. But she went on a very large dose of CBG, and she was an insulin patient, and did not tell her provider that her endocrinologist, she did not tell him that she was on a high dose CBG medication. Not that he would know what to do about it anyway. So what happened was she didn't mention anything. And all of a sudden, one morning, my colleague found his wife completely unresponsive. What had happened is that CBG and CBD and THC have shown with some patients to actually reduce your blood sugar and blood pressure levels. So if you're on an insulin and your blood sugar is going down and you're not checking it properly, and you don't tell your provider, where they would say, make sure to check it more, make sure to check it more regularly to make sure you don't go too high or too low, then she would have been fine, but she didn't say anything. So the provider is not going to suggest to change the insulin dosage when he doesn't think anything else has changed. It's the same thing with, and again, she plummeted. And she was rushed to the emergency room. Luckily, she was fine. But if she had told her provider, I'm taking high doses of CBG, even if the provider didn't know what that was or how it would affect her, they would say, make sure to test your blood sugar more often to make sure that you don't go too low or too high. Because if you don't know what it's going to do, have them check just to make sure it doesn't go too low or too high. So that's what she should have done, but obviously she didn't. Other patients I've had on blood pressure medications, and they didn't want to tell their provider they were going on cannabis, but I explained to them, well, what happens if it reduces your blood pressure and you don't tell your doctor? They're going to assume that your blood pressure medication is what's decreasing your blood pressure, not the cannabis. So they're going to think that your dose is correct, or you're going to go on it. Your blood pressure is going to go way down. And then the doctor's going to think that it's the medication and not the combination with the cannabis doing it. So that's why it's so important that they know. And I hate to say it, and nothing against providers, but if you need a provider to at least be open to the idea of medical cannabis. They don't have to know anything about it. They just have to not have a prejudice against it. If you have a prejudice against it, then you're doing yourself a disservice, because think about it. If you have a friend or a colleague that doesn't like something, you're not going to tell them about it. Same thing with a provider. If you're doing something that they don't like, you're not going to tell them about it. Are you eating your doctor? Are your dentist? Are you flossing? Yeah, of course. I floss every day. Totally. I brush my teeth after every single meal. I mean, you're lying to them. They know you're lying to them. But the providers, when it comes to cannabis, don't know you're lying, that you're not telling them the whole truth. And that can cause serious health issues, because they might increase a dose of a medication thinking you need it, like the patient who didn't have her insulin decreased, and have a big medical issue. So that's why it's so important to always let your doctor know that you are using a medical cannabis medication, that it is not an illicit drug. It is medical cannabis, and you are using it as a medical therapy. And that, and the most important thing is, if your provider is in any way against medical cannabis, then find a provider who maybe doesn't know about medical cannabis, but is not anti-medical cannabis, because all you're doing is doing yourself a disservice by not providing your full comprehensive medical status with your provider.
Right. Yes, very important. I'm so happy that my provider actually is cannabis friendly, and actually is certified to provide the evaluations for the card. So I think I lucked out with that one.
I did too. My provider, same thing. I said, I told him, like, I take CBD, during the day for my anxiety. And he's like, oh my God. And I told him my background and everything. And he actually wants me to come into some of his facilities to discuss about medical cannabis. And I'm like, sure thing. Just let me know when.
Yeah, absolutely.
It's better that they know nothing but are accepting than think they know everything or know nothing and are anti. The most important thing is just to have a provider who is not anti-cannabis, medical cannabis. That's the most important thing. And to always use the proper terminology. And when the doctor goes, oh, so you use an illicit drug? No, I use medical cannabis. It is a medical therapy, and I use it with the guidance of a medical practitioner.
Okay. That was wonderful. It's been an amazing conversation. We probably need to bring you back again and have some more conversations. Sure. But I will say, we'll talk about that because Leah's actually going to be in Georgia this summer coming up. Get to that. What I want to do before we wrap up is it's a new segment that we're calling Seeds of Compassion. And it's just where, the guest gives a meaningful thought that plants hope and knowledge into our lives. So basically, Dr. Johnson, what seed would you like to leave with our audience today?
So the biggest seed I have is it's so important that if you are a dispensary or a wholesaler with cannabis or even a grower, find a cannabis compassion program in your state. That's all I can ask you to do. That's so important because there are many patients that are actually on compassion programs. I used to work with a couple. Sadly, they were getting no sponsorship from these dispensaries, from these growers. They're not getting the products that these patients need, so they have to close. So the most important thing is there are compassionate cannabis organizations throughout the United States. So if you are a grower, if you are a vendor, if you are a company or a dispensary, look through your products, and before getting rid of ones that are going to expire in a month or so, because you can't sell it to your patients, look for a compassionate program so that way you can donate it to them, and that way patients in need that can't afford medical cannabis can still get their medical cannabis.
Wow, that's so thoughtful, and I think that should. More people should do that. And that was one of the reasons why we started the Georgia Medical Cannabis Society, was to be able to be those partners in compassion with patients, indigent patients who could not afford it, and just try to find affordable medication. Of course, being in Georgia, we don't really have everything that we need. And hopefully one day we will be able to get there to have more products. But that's something that's really near and dear to our heart. And I'm glad that you mentioned that. Got a little choked up there in thinking about that. Because our motto is patience over profits. Yep. So that's something that we basically live by, and knowing that people are out there who really need it, elderly patients who really are fixed incomes, who really could use that medication. Don't throw it away. Because she said before it expires, pass it along. Thank you so much, Dr. Johnson, for joining us today on Compassion in Action. Your insights have been just amazing. Your expertise have truly made this conversation one that I know will resonate to many. But before we officially close, I definitely want to say I want to invite all of our listeners to the Holistic Health and Wellness Summit that we're having this summer and on July 26th at the Fernbank Museum of Natural History in Atlanta, Georgia. And Dr. Leah Johnson will be one of our presenters. So you'll get a chance to hear her more there. So definitely come and join us. It's going to be a powerful gathering featuring doctors, scientists, holistic healers, and wellness advocates who are committed to advancing education around plant-based therapies, mental health, and more. So please visit our website at 2hw.com and join the list to be notified when tickets are available. And we definitely hope to see you there.
Oh, so excited to be there.
Thank you. And thank you again, everyone, for tuning in to Compassion and Action. And until next time, stay curious, stay compassionate, and remember, the seeds you plant today can grow into the healing you need tomorrow.